The English Nurse by Professor Charles Lane Olmsted. Chapter 1, Careers, a Gimcheon University presentation. Vocabulary: registered nurse, registered nurse. Occupational therapy, occupational therapy. Dental hygienist, dental hygienist. Dental technician, dental technician. Phlebotomist, phlebotomist. Cardiac sonographer, cardiac sonographer. Physician assistant, physician assistant. MRI technologist, MRI technologist. Vocational nurse, vocational nurse. Nurse assistant, nurse assistant. Speech therapist, speech therapist. Physical therapist, physical therapist. Respiratory therapy, respiratory therapy. Optician, optician. Optometrist, optometrist. Pharmacy aide, pharmacy aide. Dietitian, dietitian. Hospice nurse, hospice nurse. Pictured sonographer, sonographer. Nutritionist, nutritionist. Pharmacist, pharmacist. DNA technician, DNA technician. And pictured radiologist, radiologist. Lab technician, lab technician. Prefixes, suffixes, abbreviations. These are prefixes. Cardio deals with the heart. Cardiologist, cardiovascular, cardiology. GYNE, woman. Gynecology, gynecologist. ONCO deals with tumor. Oncology, oncologist. OPHTHALM, pertaining to the eye. Ophthalmology, ophthalmologist. Ortho, something straight or correct. Orthopedic, orthodontist. Optic, relating to chemical properties of the eye. Optician, optometrist. PEDI, deals with children. Pediatrics, pediatrician. Suffixes: ache, pain, headache, toothache. CIAN, having a certain skill. Pediatrician, obstetrician, optician. DONTICS, teeth. Orthodontics. IATRY, field of study in medicine. Psychiatry, podiatry. IST, involved in a particular field or certain interest. Psychologist, druggist. OLOGIST, person who deals with certain topics. Gynecologist, radiologist, oncologist. OLOGY, a subject of study. Biology, cardiology, oncology, ophthalmology, physiology. Sentence patterns. An MRI technologist sounds like you need years of science. A cardiac sonographer sounds like you need years of science. A phlebotomist sounds like you need years of science. I know several orderlies who went on to become a registered nurse. I know several orderlies who went on to become a radiologist. I know several orderlies who went on to become a pharmacist. A speech therapist has set hours. A respiratory therapist has set hours. A dental hygienist has set hours. An occupational therapist has set hours. I like cooking, so I will be a nutritionist. I like cooking, so I will be a dietitian. Being an optician sounds very challenging. Being an optometrist sounds very challenging. Being a hospice nurse sounds very challenging. Sentences. A registered nurse can give a shot and set up an IV, but a vocational nurse can't. Sometimes an MRI technologist will take dozens of different layers of images of an organ. Some professional sports teams have a physical therapist on staff. My brother went to a speech therapist when he was younger to get over his stutter. My father had part of a lung removed, so respiratory therapy helped him. A physician assistant will meet with patients before they meet the doctor. A nurse assistant takes vital signs of patients on the wards. A hospice nurse must be tough to handle all the death. Most sonographers work with pregnant women, but some work on heart patients as cardiac sonographer. This dental hygienist has been cleaning and x-raying my teeth for 20 years. It takes about 2 weeks for the dental technician to make a new tooth for you. The optometrist said I should get some new glasses since my left eye is a little weaker now. One phlebotomist left my arm bruised from too many failed attempts to find a vein. My mother needed an occupational therapist after the accident to learn how to do things at home. Some people work as a pharmacy aide while they continue their studies to become a pharmacist. A pharmacist has to keep up with all the virus vaccines and side effects. I need to go to the optician to get my glasses fixed since one of the lenses is loose. Lab technicians don't see patients, but they help them out a lot. The radiologist said my arm was broken in 2 places, not 1. The dietitian helped lower my blood pressure and cholesterol when she evaluated my eating habits. A nutritionist has helped me lose 10 kilograms with her balanced meal plans. Pictured on the right, today's nurse. Conversations A between Song and Jinso. What do you want to specialize in? Either geriatrics or pediatrics. Interesting. Older people or children. The 2 extremes. Both are in demand, but not hospice. Maybe extended living. What about you? Hospice or oncology? My mom was in obstetrics, but I can't do that. I think helping deliver a baby would be easier than seeing people die. It would, but I have 3 little brothers to take care of, and I have 2 toddlers now. Understandable. My kids keep me busy enough. How old are you? 29. My first degree was finance, but I didn't like working at a bank. Questions. What 2 fields is Song interested in? What about Jinso? Why doesn't Song want to work pediatrics? 3. Whose mother helped deliver babies? 4. Which field do you think deals with patients who will die soon? Discussion questions. Which of the 4 fields mentioned do you think would suit you most? Have you decided on your medical field? If so, what is it? If not, what are you considering now? Which area of nursing do you think would be most challenging? Why? Extra. Change the conversation by picking some different fields. What would those fields deal with? Discuss some advantages and disadvantages. Conversation B between counselor and Emma. You can wait a year if you haven't decided on a field yet. The important thing is get your nursing license. Are the courses the same for the first year? Oh yes, there are plenty of science and nursing classes to keep you busy. Do you need a nursing license to take anesthesiology classes? Yes, people will get the license and usually work as a nurse for about 5 years. They start taking the anesthesiology classes while they continue to work. Do they have those classes here? No, we are working on it though. We hope to have a program in 2 years. What programs are here? Endocrinology, endocrinology pediatrics, diabetes, pain management, critical care, and dialysis. Some just need experience and a test, and some need experience classes and a test. That's a lot to think about. True, but the good thing is you can get your first job, get some experience, make some money, and find out what you like. Then you can take the next step. Questions. What specialty is Emma looking for? Do you need a nursing license for that specialty? Is it available where she is? What special programs do they have? What are the requirements? Discussion questions. Why would they have specialty fields? What specialty would interest you? What do you think would be other specialties? Extra. Change the conversation by picking some different fields. What would those fields deal with? Discuss some advantages and disadvantages. Reading. What area? Deciding the medical field you want to pursue can be challenging. In the United States, some require medical degrees while others need a professional degree, such as registered nurse or physical therapy. Some require 2 years of college work. Most require specialized training after your education. The following are a small sample of jobs with different conditions and requirements in the United States. A registered nurse needs a 4-year degree, plus you need to pass a national state test. An RN can inject patients, start an IV, and perform many duties as instructed by the doctor. If you have an RN degree, you can specialize in another area with more training and experience. Hospitals have different departments where nurses can learn a specialty, such as pediatrics, geriatrics, surgical, or emergency room. Being an ER nurse can be stressful, but very rewarding because people are usually there for life and death situations. It is very demanding physically, mentally, and emotionally. One mistake could cost a person's life, and even if everything is done right, the patient may still die. You will need another year of training after passing the nurse's exam, whether RN or LVN. Specialized training to become a pediatric nurse is usually 3 months of internship once you have your nurse's certification. Pediatric nurses must be able to put the child at ease, since many enter the hospital nervous and scared. They can be crying, uncooperative, and not able to communicate what the problem is. A nutritionist can work at a hospital or assisted living center. A nutritionist plans healthy meals with the patient's condition and limitations in mind. Is the patient diabetic? Does he have a weak stomach? What kind of surgery did he just have? Is he on medication? Plus, the food must be tasty. A physical therapist needs a degree in physical therapy in a bachelor's or master's program and be certified. A physical therapist may help an athlete rehabilitate after surgery, or help someone walk who was injured in a car accident or a fall. As a country's population ages, there will be a bigger need for physical therapists. You would be responsible for testing their current health status, then recommending treatment to help them regain function of the injured part of their body. You have to keep good records of the patient's progress and what you have prescribed. You will also have to give them activities they can do at home. The therapist will be on their feet a lot and need to maintain their own physical fitness. Read the rest of the story in the book, and as you go along, underline words you have problems pronouncing and circle those you don't know the meaning of.